Hi guys, I'm Sungi Romo and I'm going to talk about the chlamydia and other diseases. Definition. Chlamydia is a common sexually transmitted disease. It is caused by bacteria called Chlamydia trachomatis. It can infect both men and women. Women can get chlamydia in the cervix, rectum, or throat. Is one of the most common bacterial sexually transmitted diseases worldwide. Most infections are asymptomatic in women, leading to ascending infections and reproductive tract sequelae.
Hi there, my name is Dr. Dominic Brody and I'm the Medical Director of Let'sGetChecked.com. I'm also a consultant physician in genitourinary medicine. This is also commonly known as infectious diseases in different countries. I'm here today to talk to you about chlamydia infection because this is one of the most commonly sexually transmitted infections in the world, and it's also one of the most common infections that we find diagnosed through our kits. So what is chlamydia? Chlamydia is a sexual infection and it's caused by a bacteria called Chlamydia trachomatis. It's incredibly easily transmitted and it can be transmitted through oral, anal, vaginal sex and through skin-to-skin contacts.
Epidemiology. Chlamydia trachomatis is one of the most frequent sexually transmitted bacteria in the world, estimating around 89 million new cases each year. In the USA alone, 4 million cases are represented annually, with an estimated cost of US $2.4 billion. In the Western world, chlamydia infections is one of the most common sexually transmitted diseases. It can infect in a way associated with gonorrhea, which happens in 20 to 40% of cases in men and 40 to 60% of cases in women.
Hello, I'm Joanna Lewis and I work at the National Institute for Health Research, Health Protection Research Unit in Modelling Methodology at Imperial College London in partnership with Public Health England. I'm going to introduce some work that I did with Peter White, estimating local chlamydia prevalence using publicly available surveillance data. Chlamydia is a common sexually transmitted infection, but it's difficult to control because most cases are asymptomatic and so people don't seek treatment. The high proportion of asymptomatic cases also makes it difficult to know the extent of the problem, so how many people are infected in high-risk groups. The goal of our work was to develop a model which could take data on local testing and diagnoses and use it to calculate local prevalence and incidence. Using our method, we were able to estimate local chlamydia prevalence in every local authority in England, and that data is shown on the maps. Although there was uncertainty in the absolute values of the prevalence estimates, there was also strong evidence of variation in prevalence between local authorities across the country. We also found that prevalence was generally higher in women than in men. Finally, we looked at the relationship between incidence and prevalence in opposite sexes, and we found that local incidence in each sex was broadly proportional to local prevalence in the other.
Symptomatology. Pain and burning when urinate, pain during sexual intercourse, pain in the lower abdomen, abnormal vaginal discharge, may be yellowish and have a strong odor, blending between menstrual periods.
Chlamydia is a dangerous yet common and curable sexually transmitted infection, STI, that can cause chronic pelvic pain and infertility. Unfortunately, 75% of women infected with chlamydia do not show symptoms until complications have already occurred. In order to get timely treatment, therefore, it is essential for women to understand and be able to recognize the symptoms of chlamydia when they do occur in order to get treated promptly. Note vaginal discharge. If you experience unusual vaginal discharge, this may be a sign of chlamydia infection or another STI. Signs that vaginal discharge is abnormal may include a different or unpleasant smell, a darker color, or a texture you've never experienced before. If you suspect that your vaginal discharge is abnormal, consult your doctor, gynecologist, or other health professional for testing and treatment. Bloody discharge between periods can also be a sign of chlamydia. Pay attention to pain. Pain during urination and/or pain during intercourse could be a sign of a chlamydia infection. If you experience pain or extreme discomfort during sex, refrain from intercourse until you can be examined by a health professional. Chlamydia infections can cause pain during vaginal intercourse for some women. Burning pain during urination usually indicates some sort of infection, from a yeast infection to an STI. Seek medical treatment at once. Check for bleeding after sexual intercourse. Some women experience minor bleeding after vaginal intercourse, and this symptom is sometimes associated with female chlamydia. Tell your doctor about rectal pain, bleeding, or discharge. Bleeding, pain, and/or discharge from the rectum are symptoms of chlamydia. If you have vaginal chlamydia, the infection could have spread to the anus. If you engage in anal sex, the infection could be based in the rectum. Watch for mild and slowly progressing lower back, abdominal, and pelvic aches. Women may also experience higher back pain, similar to kidney tenderness.
Treatment: 500 milligrams of erythromycin administered orally 4 times a day for 7 days. 500 milligrams of amoxicillin administered orally 3 times a day for 7 days. 2050 milligrams of erythromycin administered orally 4 times a day for 14 days. 1 gram of azithromycin administered orally 1 dose.
How to treat chlamydia. Chlamydia. Chlamydia is a sexually transmitted disease, STD, caused by Chlamydia trachomatis bacteria. Complications such as infertility, other STDs like HIV, prostate gland infection. There are little to no noticeable signs. A man, however, feels testicular pain. Confirm the diagnoses of chlamydia. Make an appointment with your doctor. Tell your doctor about the symptoms you're experiencing or chlamydia signs that you've noticed. Undergo medical examinations. If you're a female, your doctor performs an exam that is similar to a pap test. The doctor takes a swab of the discharge from the cervix and submits it to a laboratory for testing. However, if you're a male, your doctor inserts a slim swab into the opening of your penis and takes a sample of the discharge from your urethra. If you've engaged in oral or anal sex, your doctor takes a swab of your mouth or anus for chlamydia testing. In addition, you may have to provide a urine sample to detect an infection. Treat the chlamydia. Usually, the infection disappears after 1 or 2 weeks. Take antibiotics depending on how far the chlamydia has progressed. Abstain from any sexual intercourse or sexual activity such as anal or oral sex during treatment. Abstinence is required to avoid reinfection or passing the STD to someone else.
Complications and other diseases. Infertility, the ectopic pregnancy, the chronic pelvic pain syndrome, chlamydia due to conjunctivitis. Conclusion. In my opinion, I think the best method that people can use is protection, abstinence, and avoid promiscuity to lower the index of people with sexually transmitted disease, especially chlamydia. Chlamydia is one of the most common sexually transmitted diseases, um, especially in our environment. Its resolution is simple if it is detected and tracked in time, but it can have serious consequences if it's not handled. Prevention includes the practice of safe sex, information, and continuous checkups. The treatment will always be given to the sexual partner as well. Thank you.